Welcome, curious minds, to another deep dive. Today, we're stepping into the fascinating, sometimes uncomfortable world of animal health.
Yeah, it can be.
We're zeroing in on a condition that sounds simple foot rot, but it's actually, well, far more complex
And
and impactful.
definitely impactful for a surprising range of animals, too.
Exactly. So we're going well beyond just the basics here.
Indeed. We're
Yeah.
going to truly unpack ulcerative pododermatitis, that's its proper scientific name,
Right.
and explore how it manifests into really distinct but equally captivating animal groups, the Camelidae. So camels, llamas, alpacas,
Familiar faces.
and the Cervidae, or, deer species.
So our mission today is to understand not just the causes and the often quite painful clinical signs,
Very painful, yeah?
but also the crucial diagnostic methods, treatments, and importantly, prevention strategies. These are vital for animal well-being.
Absolutely.
Get ready for some, I think, genuinely surprising facts and maybe a deeper appreciation for that delicate balance that keeps animals healthy.
Let's dive in.
Okay, so let's start at the very beginning. What exactly is ulcerative pododermatitis? What's driving it?
Okay, so at its core, it's a severe inflammation and ulceration. We're talking the skin and the underlying tissues of the foot.
Nasty
It
stuff.
really is. And it's almost always driven by bacterial infections. But here's the key thing. It rarely happens in a vacuum.
Right. It's not just the bacteria on their own.
Exactly. It's typically a combination. You've got those bacterial invaders plus poor environmental conditions and usually some kind of trauma to the feet.
Okay, so like a perfect storm situation.
Sort of, yeah.
And what are the main bacterial culprits we're talking about? Are these common bugs?
The most common ones are Fusobacterium necrophorum and Diclobacter nodosus.
Oh, okay.
And what's kind of remarkable, especially with Fusobacterium necrophorum, is that it's often just a normal inhabitant. You find it in the animal's digestive tract, it's in the soil,
So it's everywhere.
pretty much. Yet it becomes incredibly destructive when the environmental conditions
Yeah.
create that perfect storm, as you
Yeah.
said. Other bacteria, like Truparella pyogenes and Staphylococcus species, they can also play a role, jump in on the action.
And how do they get in?
They tend to invade through any break in the skin, even tiny ones, often created by a minor injury or just prolonged exposure to wet, muddy conditions that soften up the tissue.
So the wetness is key. It softens the defenses.
Precisely. It makes the skin vulnerable.
That's a crucial insight. It's not just the bacteria, but the conditions that let them thrive.
Yeah.
Now let's talk camelids, llamas, alpacas.
Yep.
When we think about animals really prone to foot rot, like sheep, for instance,
Yep.
do camelids fall into that same category, or is their experience a bit different?
That's actually a really great distinction to make. While camelids aren't generally considered prone to what we traditionally call true foot rot, the kind you see in sheep, with Diclobacter being a major player,
Okay.
they can absolutely develop similar and equally debilitating foot conditions. It happens under specific circumstances.
Such as,
The main trigger for them is often that prolonged exposure to moisture combined with some kind of trauma. It really shows their adaptations, but also their vulnerabilities in certain environments.
interesting. So if it's not quite true foot rot, what do these specific conditions look like in, say, llamas and alpacas?
Well, you might first see something called interdigital dermatitis.
Mm.
That's inflammation and infection right there in the skin between their toes.
Okay, between the toes.
Yeah. And then there's also a form of ulcerative pododermatitis. Sometimes people call it immersion foot, which is pretty descriptive.
Immersion foot, because they've been standing in wet.
Exactly. You'll see blistering and even slough in, like the pad tissue actually peeling away.
Ouch.
Yeah. And what's particularly surprising and highlights how bad it can get is that in severe cases, these lesions aren't just on the feet.
Oh, where else?
They can appear on the ventral abdomen, that's the underside of the belly,
Wow.
the perineum, between the hind legs, and even the axillae, like the armpit region.
That's wild. It spreads that far.
It shows how systemic the problem can become when the infection gets really severe.
Okay, that's a really surprising detail. So what specific things put camelids at risk for these particular conditions?
Well, the predisposing factors are pretty clear, unfortunately. Prolonged exposure to wet, muddy, or just generally unsanitary conditions.
Right, the moisture again.
Always the moisture.
Mhm.
It can macerate the skin, basically soften it up significantly, creating easy entry points for bacteria.
Macerate. Okay.
Then add trauma to the feet, maybe from rough ground, combined with maybe inadequate hoof care, poor bedding, or just bad pasture conditions. They all play a role.
And environment, like how they're kept.
Absolutely. Overcrowding is a factor. poor drainage in their pens or pastures. Simply a lack of a dry place for them to rest. These are all common culprits.
Makes sense. And how would someone spot this in their llama or alpaca? What are the key signs to look out for?
In the milder cases, you'd probably notice some swelling, redness, maybe a mild lameness, just a bit of a limp. You might also notice a foul odor, kind of distinctive, and the area might feel warm to the touch.
Got it. In more severe cases.
Then you'll see painful ulcerations, actual necrosis, that's tissue death,
Oh, dear.
and deep infections that lead to quite severe lameness. I mean, really struggling to walk. This can even escalate to abscesses forming.
Abscesses, okay.
And in the really advanced cases, the damage can go right down to the underlying bones and joints. That often means chronic, long-term lameness, and even permanent hoof deformity. It's incredibly painful for them.
It certainly sounds it. So how do vets typically diagnose this and then, treat it once they've found it in camelids?
Diagnosis usually kicks off with a thorough clinical exam, looking for those characteristic lesions, assessing how lean the animal is.
Just looking and feeling?
To start, yes. Then, to figure out exactly which bacteria are involved, they'll take swabs for a microbial culture.
Okay, lab work.
Exactly. And in those severe cases, X-rays radiography can be really vital. They help assess if there's damage to the bone or joints hiding beneath the surface.
Right, see how deep it goes.
Precisely. For treatment, the initial focus is always meticulous cleaning of the affected foot and debriding any loose or dead pad tissue.
Debriding, carefully removing the damaged stuff.
Exactly that, carefully cutting away the unhealthy tissue. Then, topical antiseptics are key, things like zinc sulfate or copper sulfate, often applied using foot baths.
Foot baths, right, like for sheep.
Similar principle, yeah. For the deeper infections, though, you need systemic antibiotics, things like penicillin or oxytetracycline, given by injection usually.
Okay, hitting it from the inside too.
You have to. And supportive care is also essential. Pain management, usually with NSAIDs, non-steroidal anti-inflammatory drugs.
Like animal ibuprofen, basically.
Sort of, yeah. And providing soft, clean, dry bedding makes a huge difference to their comfort and healing.
Seems like a pretty comprehensive approach. Given all that effort for treatment, what are the most critical things for actually preventing these painful conditions in camelids?
Prevention is absolutely paramount here. It really boils down to maintaining dry, clean living conditions, making sure there's proper drainage in their enclosures.
Keep them dry.
Keep them dry. Minimize exposure to wet or muddy environments as much as humanly possible. Regular hoof trimming and inspection are also vital.
Catching problems early.
Exactly. And maintaining healthy foot structure. And of course, consistent hygiene and disinfection of facilities, barns, shelters that helps prevent bacterial buildup and stops it spreading.
Makes sense. What's the outlook usually?
For mild cases, if you catch it early and treat promptly, the prognosis is generally good. But for severe cases, especially if bone is involved, well, the prognosis can be guarded. It can be tough to fully resolve.
Okay, so we've covered a lot about camelids. Very insightful. But what happens when these same principles, or similar ones, play out in a completely different setting, like with deer populations?
Yeah, that's where it gets really interesting.
Because deer aren't typically managed like livestock, especially wild ones. Are they affected in similar ways, or is their experience with foot rot, markedly different?
That's an excellent question, and it really does highlight the shared vulnerabilities across species, but also the differences in context. Foot rot and related hoof diseases are actually a significant concern in both wild and farmed deer populations.
Oh, really? In wild deer, too?
Absolutely. And outbreaks are very often linked directly to environmental conditions, just like with the camelids.
Huh. Same culprits.
Pretty much. Much like with camelids, Fusobacterium becroforum and Diclobacter nodosus are often the primary bacterial causes. And again, Fusobacterium is commonly found in the soil, in animal digestive tracts. So wet, muddy conditions become a real hazard zone.
So what puts deer specifically at risk, either in the wild or on farms?
Again, wet, dirty environments are huge factors. Number one, really. Add to that trauma to their feet, maybe from sharp rocks, rough terrain, even fighting. Overgrown hooves can be an issue, especially if their environment doesn't naturally wear them down. And in farm settings, high stocking densities definitely increase risk.
Too many deer in one place.
Yeah, concentrates the bacteria and moisture. And prolonged wet, rainy weather is particularly risky. It just allows these bacteria to proliferate like crazy in the soil.
Right. More bugs everywhere.
And critically, it softens the hoof tissue itself, making it much more susceptible to injury and then bacterial invasion.
Softer hooves, easier entry.
Exactly. Inadequate natural shelter and poor nutrition can also weaken their immune systems, making them more vulnerable overall.
Right. A stressed or weak animal is always more susceptible. What are the clinical signs you might actually observe in deer? I imagine it could be hard to spot in wild animals until it's quite bad.
That's true. Lameness is almost always the first and most obvious sign you'd see, whether it's just a slight limp or they're clearly unable to bear weight on a leg.
Okay, limping.
You'll also notice swelling of the foot. Sometimes it's quite dramatic. The foot can swell to 2 or even 3 times its normal size.
Wow, that much.
Yeah. Often you'll see abscesses forming just above the hoof line. These contain this thick, really foul-smelling pus. And the bacterial toxins cause severe necrosis, that tissue death we talked about. It can actually destroy the underlying bones of the hoof.
Destroy the bone. Goodness.
Yeah. In chronic cases of these related diseases, the hooves might even look broken or severely malformed, kind of ringed. And sadly, the tips of the hooves can sometimes just slough off completely.
That sounds incredibly painful and debilitating for an animal that relies so much on its agility for survival.
It absolutely is.
Are there other related hoof conditions that affect deer beyond what we might call classic foot rot?
Yes, and this brings up an important point about sort of species-specific nuances. There's a distinct and very concerning condition known as treponeme-associated hoof disease, or TAHD.
TAHD.
Yeah. Some people also call it elk hoof disease
Right.
because it was first really recognized in elk.
Oh,
It primarily affects elk populations in states like Washington, Oregon, Idaho, California, and is associated with different bacteria treponema species.
different bacteria, different disease.
Similar outcome in some ways, but different cause. It leads to severely deformed, overgrown, broken, or even completely slowed hooves. It's a really significant challenge for wildlife managers in those areas.
Wow. Okay, so given all that, how do we approach treatment and management for deer, especially wild ones? Is it even feasible?
Yeah, for wild deer, individual treatment is generally not feasible. The challenges of capture, repeated treatment, stress, it's just usually not practical or effective on a population level.
Right, you can't exactly give a wild deer herd foot baths.
Uneasily.
Yeah.
For farm deer, however, it's a different story. Systemic antibiotics like penicillin or oxytetracycline and topical hoof rot sprays can be used, similar to other livestock.
Okay.
But honestly, for both wild and farm deer, prevention is by far the most effective strategy. That's where the focus really needs to be.
Makes sense. So how does prevention work for deer, especially thinking about wild herds?
Well, for wild populations, it often comes down to maintaining overall herd health, ensuring they're well-nourished, have adequate mineral intake that supports strong immune system.
Healthy animals fight things off better.
Exactly. Environmental management, where possible, is critical. Trying to prevent deer from congregating and standing for long periods in wet, muddy areas.
How do you even do that in the wild?
It's tough. Sometimes it might involve strategic placement of supplemental feeders, if used, on higher, drier ground, or managing water sources. In farmed operations, it's easier. You can place rubber mats around feed sites, improve drainage, manage stocking density.
More control?
Much more control. And for the specific contagious foot rot caused by Diclobacter nodosus, biosecurity measures become really important for farm deer.
Biosecurity, like keeping disease out.
Yeah, protocols to prevent disease introduction and spread.
Yeah.
Things like quarantining any new animals brought onto the farm.
Yeah.
And potentially using foot baths with zinc sulfate or copper sulfate, similar to those used effectively for sheep.
Okay, so some overlap with sheep management there for farmed deer.
Definitely some transferable practices, yeah. You know, if we try and connect this to the bigger picture, what's truly fascinating here, I think, is how similar environmental conditions,
Yeah.
and sometimes even the very same bacteria, can cause such devastating issues across vastly different animal species. You've got desert-adapted camelids, forest-dwelling deer.
Right, totally different animals, different feet even.
Exactly. A deer's agile hoof versus a camelid's padded foot, yet the underlying principle holds. Persistent moisture plus some minor trauma creates this dangerous gateway for common bacteria to cause really profound problems, sometimes even systemic ones.
It really does highlight how crucial environmental management is, not just for the domestic animals we directly oversee, but for wildlife populations too. Their health is so tied to the state of their habitat. What stands out most to you about the shared lessons here, looking at both camelids and deer?
I think what becomes crystal clear is that foot rot isn't just some simple ailment with a single cause. It's this complex interplay, between specific pathogens, the environment they're in, and the animal's own individual susceptibility or health status.
Right. The whole picture matters.
The whole picture. For livestock, yeah, it leads to significant economic loss. But for both wild and farmed animals, fundamentally, it causes immense pain. It severely impacts their ability to move, to graze or forage, find water,
Yeah.
and ultimately to survive.
Yeah.
So understanding these conditions, and especially those environmental triggers, is just vital. It's vital for promoting animal welfare and for developing management strategies that actually work.
And that's our deep dive into ulcerative pododermatitis, or foot rot, in camelids and deer. We've seen how this condition, which sounds pretty straightforward,
Yeah, foot rot sounds simple.
right, is actually this really multifaceted challenge,
Yeah.
deeply intertwined with environmental conditions, specific bacteria, and impacting animals all the way from desert dwellers to forest inhabitants.
It really is a powerful reminder, isn't it? How environmental factors directly impact animal health, often in ways we might not immediately think of, and how much difference proactive management or even just understanding these connections can truly make.
Absolutely. So what does this all mean for you listening? Well, maybe next time you see an animal out and about, perhaps a deer grazing in a wet field or a llama in a pasture, just consider the unseen battles their feet might be fighting against their very environment. This deep dive really shows us how important it is to look beyond the obvious surface-level ailments and appreciate that intricate balance of animal well-being.
Well said.
Which makes you wonder, what other seemingly common animal ailments might hold surprising complexities if you were to truly dive deeper into them?